Hello viewers, welcome to the Learners Nursing classes. Today I will be dealing with the multiple choice questions related to high target nursing. They are very important multiple choice questions which have come in previous exams. So let us start. When does the anterior fontanelle close in the child? So anterior fontanelle is the fontanelle present on the head of the baby, and one is anteriorly, one is posteriorly. The anterior one is called as anterior fontanelle and the posterior one is called as posterior fontanelle. So when does it closes in the child? 6 to 8 weeks of life, 6 to 8 months, 12 to 18 months and 12 to 18 weeks. अगर आप छोटे से बच्चे के हेड को पैल्पेट करोगे सर को, तो यू विल फील कि वहाँ पे एक गैप सा है डायगोनल शेप्ड, एंड दैट इज कॉल्ड एज एंटीरियर fontanelle which closes by 12 to 18 months of age. For assessing the gestational age of a preterm infant, the nurse should be जब हमें बच्चे की gestational age determine करनी है, whenever there is a newborn baby where we do not know the period of gestation, the mother is not able to give the proper history, or she was having irregular menstrual cycle, so we do not know the age of the child, and for the initial management of a neonate we need to know the approximate gestational age. What are the assessment criteria? Now nurse should examine the palmar creases, the reflex stability, the breast bud size, or the head to toe length of the baby. So here a nurse will examine the palmar crease. Palmar crease मतलब हाथ में जो creases होती हैं उसको आइडेंटिफाई करके हम बच्चे को आइडेंटिफाई कर सकते हैं कि ये IUGR बेबी है या ये प्रीटर्म बेबी है. Delivery of baby happens in which stage of labor? See, whenever a newborn baby is born by the process of normal labor, the stage is considered. There is first stage, second stage, third stage, fourth stage of labor in which the baby is delivered. That stage we have to identify. So options are first stage, second stage, third stage, fourth stage. Here the answer is the second stage of labor. The second stage of labor में baby is expelled, and immediately after the expulsion of the baby, the third stage start in which the delivery of placenta happens. When a drug is to be given at bedtime, which of the following coded instruction is used? There are symbols used while giving drug. So SOS, OD, HS, AC. Here when the drug is given at the bedtime, the coded instruction is used is HS. Identify the following procedure that nurse is doing in the following image. See, what is the procedure a nurse is performing? She's trying to make a fluid in which she is trying to inject some drugs, and it is white lipid like fluid. This is basically, what are the options? The TPN means total parenteral nutrition, the dialysis fluid, the hydration fluid, or the lavage solution. So here the nurse is loading the total parenteral nutrition for the patient. Identify the machine. The machine in the picture given we have to identify. So it is autoclave machine, or the ultrasonic instrument washer, or the high risk medication cupboard, or the none of the above. See here, this machine is an autoclave machine. Identify the catheter in the following image. See, there is a catheter which is inserted from here. It is going into the subclavian. So what is the catheter? It is central venous catheter, intra-arterial line, peripheral inserted catheter, or none of above. See, whenever there is a line which is peripherally inserted into the body and going into the central catheter, central venous axis, then it is called as peripherally inserted central catheter. So answer is peripherally inserted central catheter. Identify the procedure done in the image. See, there is a boy who is having a tube which is going into the nose and it is fixed here on the cheeks and it is hanging. So we have to identify this. What is it? Is it a nasogastric insertion? It is a nasojejunal tube insertion, endotracheal tube insertion, or it is none of the above. So here we should know what is nasogastric tube. Nasogastric tube is a tube which is going into the nose and then going into the gastric means stomach में जा रही है. उसके बाद nasojejunal tube जो होती है वो नाक से होके jejunum तक जाती है. तो how to insert a tube into the jejunum is, we are supposed to insert the nasogastric tube in the stomach and leave it overnight थोड़ा एक्स्ट्रा हम अंदर डाल देते हैं, और जब वो क्या करती है, ओवरनाइट पेरिस्टालसिस के साथ वो इट गोज इनटू द जेजुनम. That is the way we put nasojejunal tube. Endotracheal tube is a tube which goes into the mouth and then goes into the trachea, or it may go into the nose and then goes into the trachea. So that is endotracheal tube. And option none of above nahi hai. So here the answer is nasogastric insertion. The nurse is aware that the most common assessment finding in a child with ulcerative colitis is option A, intense abdominal cramps, B, profuse diarrhea, C, anal fissure, D, abdominal distension. See, whenever there is a finding that child is having ulcerative colitis, how the child will present? Child will present with the profuse diarrhea. There will be no absorption of the food and there will be profuse diarrhea. Renal failure symptoms not common in renal failure. Renal failure symptoms which are not common in renal failure: hyperkalemia, urine output, hyponatremia, hypokalemia. See, hypokalemia is one of the renal failure symptom not common in renal failure. Hypokalemia नहीं होता renal failure में, most of the time hyperkalemia होता है. और यहाँ इस ऑप्शन में आएगा altered urine output. So here the answer is hypokalemia. Child diagnosed with moderate dehydration is to be treated with, if the child comes to you with the moderate, there are mild, moderate and severe dehydration, and the child comes to you with the moderate dehydration, we will treat the child with 5% dextrose, 10% dextrose, 25% dextrose or a normal saline. So we will treat the child with normal saline. Normal saline is the right answer. Identify the instrument in the image. See, we have to see this instrument. There is an earpiece, ear speculum, there is a head, there is a lens, and there is a body handle in which there is a battery. So is it an otoscope, a tonometer, ophthalmoscope, or none of the above? So this instrument is an otoscope used by head and neck and throat surgeons to identify or to evaluate your ear. Following is the picture of sterile sponge used in the surgery. See, this is the sterile sponge used in the surgery. It has got a blue lining on the thread. What is the purpose of this blue lining? What is the purpose of this blue thread? This blue thread, option A, is a radio opaque lining. Blue color is visible when it is used during surgery. No specific purpose is there, or it is a design of the gauze. See here, the answer is the blue line is a radio opaque lining. And what does radio opaque means? When these gauze pieces with the blue line are used, and sometimes during the end of the surgery your count is not correct as per the count board, then you can go for a check C-arm X-ray to identify whether this is lying in the body cavity or not, because any foreign body in the cavity cannot be left inside the patient's body during the closure of the procedure, and we only tend to keep the implants and not any foreign body which is the part of the surgery. The shown below instrument is used in which surgery? See, this instrument actually is a Joule's retractor, and ये कौन सी surgery में use होता है? In which surgery this is used? Let's see the option: thyroidectomy, abdominal surgery, thoracotomy, or cesarean section. See, Joule's retractor is a very, very classical instrument of the thyroid surgery, thyroidectomy. Identify the instrument used in the neonatal resuscitation. This is an article actually used in the neonatal resuscitation. So what is it? Endotracheal tube, ambu bag, airway, spirometer. So this particular product item is ambu bag. See, this is an ambu bag. This is an ambu bag. Identify the figure given. This is a surgical instrument used in a specific surgery. What is the name of the surgical instrument we are supposed to identify? So let us see the option: Hoffman retractor, Paravoof retractor, Doyen's retractor, Denver retractor. See, the answer is Doyen's retractor. Actually, it is called as Doyen's pelvic retractor, used for in cesarean section to retract the bladder. and to see, visualize the lower segment of the uterus. Patient in emergency department comes with the total burn of 65%, but the genitalia area cover how many percent of the total body surface area? So here the question is कि patient आया emergency department में 64% burns के साथ. अब question ये है कि genitalia कितना total burns surface area cover करता है? So 9%, 18%, 1% or see this is 12% option. Now here the answer is 1%. 1%. The perineum covers the 1%. Placenta implantation abnormality. Placenta implanted deeply into myometrium is called as, what is it called? Placenta accreta, placenta increta or placenta percreta. These are all the type of abnormalities where the placenta is attached into. So here the answer is placenta increta. Now, identify the blade size. What is the size? There are names defined as per the blade. So, we have to identify this. Option A, 11. Option B, 15. Option C, 21. And option D, 22. See here, the answer is, it is 11 number blade, which is also called as stab knife. Surgeon may ask you, give me a stab knife. You are supposed to give 11 number blade on the Bard Parker handle. After rapid blood transfusion, patient shows tetany, indicates. What does it indicate? Option A, hypocalcemia. B, hyperkalemia. C, hypokalemia. D, hypercalcemia. So here the answer is hypocalcemia. Main purpose of ankle tie bandage is to immobilize the joint while providing heat and compression to the bones, to promote healing, to prevent ankle displacement fracture, and to prevent infection. See, ankle tie bandage is actually used to immobilize the joint while providing heat and compression to the bone. The vital sign among the following is, the vital signs are temperature, blood pressure, and pain is the fifth vital sign. So here the question should be the vital sign among the following. Which one is not the vital sign? So answer is SpO2 is not the vital sign. Though it is one of the sign, but it is not the vital sign. The longest bone in human body is humerus, femur, tibia, radius. See, humerus is present in the hand, femur is present in the leg, thigh, tibia is present in the lower leg, and radius is present in the hand. So, answer is femur is the longest bone of the body. In laparoscopic surgery, which gas is used? See, options are CO2, nitrous oxide, oxygen, or heliox. See, the gas used in laparoscopic surgery for pneumoperitoneum is carbon dioxide. Cannula size for the rapid IV infusion is 16 gauge, 18 gauge, 20 gauge, 22 gauge. Here the option answer is 16 gauge. In which episiotomy there is a tear anal sphincter? In which episiotomy tear anal sphincter is intact? Matlab ki the episiotomy has not stretched or extended to the sphincter. Option first degree, second degree, third degree, fourth degree. Here the answer is second degree. Iron dextran given by which route? Option intravenous, intramuscular, intraosseous, intradermal. Here the answer is intramuscular. See, iron dextran is always given intramuscular. Which anti-epileptic given by intranasal route? Intranasal matlab naak ke through. So whenever you are giving through nose, you may give a spray or you may give a drops. So what is an anti-epileptic that is given intranasal? Options are midazolam, diazepam, clobazam and nitrazepam. So answer is midazolam. Intramuscular injection is given at which angle? 15 degree, 25 degree, 45 degree, 90 degree. Here the answer is the intramuscular injection is always given 90 degree. The term decreased number of RBC is, the number of RBC decreases anemia, pancytopenia, leukemia, thrombocytopenia. Answer is anemia. SSPE is complication of which disease? We should know what is SSPE, that is subacute sclerosing panencephalitis, and it is the complication of which disease? Whooping cough, measles, meningitis or tetanus. Here the answer is measles. It is a progressive neurological disease of complicated measles. Which disease not includes in mission Indradhanush? Indradhanush mission is launched by the government, and in which disease is not included from the option? Option A, tetanus, B, diphtheria, C, pneumonia, and D, whooping cough. Here pneumonia is not included in mission Indradhanush. Which is not the true feature of preeclampsia? C, polyuria, proteinuria, edema, increased systolic blood pressure. See, polyuria is not the true feature of preeclampsia. Find out the problem in the following image. If you see this image, there is a protrusion of the abdominal content from the sac. So, we have to identify the problem. In which condition? Like inguinal hernia, incisional hernia, scrotal hernia, or the none of the above. See, answer is inguinal hernia. Identify disease based on the following image. This is the picture in which there is a mesh-like structure, which a net-like structure. इसे कहते हैं mesh, और इसके बेस पे हमें डिजीज़ आइडेंटिफाई करनी है. तो ये कौन सी बीमारी में इलाज की तरह यूज़ होता है? यूज इन द ट्रीटमेंट ऑफ inguinal hernia, thoracotomy, bleeding disorder, none of the above. Answer is it is used in the inguinal hernia, and the procedure is called as Lichtenstein mesh repair. A nurse is posted in the emergency department and the patient comes with seizure. The priority management of seizure will be, the options are airway management by side lying position and head turn, controlling seizure with medications, circulation management with IV fluids, none of the above. Here the answer is airway management by side lying position and turning the head towards one side is the first management of seizures. Marked area shown in the picture is, we have to identify which is the region. See, options are axillary region, cubital region, thoracic region, none of the above. So here this answer is, this is the cubital region. Thank you viewers. Like, subscribe and share.